Hello students, welcome to Pathology PYQ series. We have done hypersensitivity chapters. One question which I found was asked in many university exams was differentiate between type 2 and type 3 hypersensitivity. So it is a very important PYQ which you should must master. What are the basis of comparison? See, type 2 hypersensitivity is an antibody-mediated reaction against fixed antigens on cells or tissues, whereas type 3 hypersensitivity is caused by deposition of circulating immune complex. Okay, so at the antigen level, what is the difference? In type 2 hypersensitivity, antigens are fixed on a cell surface or extracellular matrix. They are not floating around. But in the type 3 hypersensitivity, antigens are soluble and form immune complexes. So antigen, when after forming immune complexes, it is in the circulation. So very important point. Antibody type 2 reactions are mediated by IgG or IgM. Any one of them can cause directed against cell-bound antigens. And type 3 reactions involve IgG antibodies forming immune complexes with soluble antigens. So in the at the antibody level also type 2 IgG or IgM anyone, whereas in the case of type 3 only IgG will be there. Mechanism of injury. See, type 2 hypersensitivity causes tissue injury by complement activation, opsonization, or ADCC. Whereas type 3 hypersensitivity causes injury due to immune complex deposition, followed by complement activation and neutrophil mediated inflammation. What are the sites of damage? Type 3 hypersensitivity produces localized tissue injury at the site of antigen expression. Because our antigen is fixed, so the damage would be there where the antigen is being fixed. However, at the type 3 hypersensitivity, commonly affects blood vessels because it's in the circulation. And where does the blood circulate? In the blood vessels, kidneys or joints. What are the examples? Examples of type 2 hypersensitivity is autoimmune hemolytic anemia, Goodpasture syndrome, and myasthenia gravis. Myasthenia gravis, you must have studied in your first year. It is a neurological disorder where the patient lacks key control over the muscles. What is type 3? Type 3 is serum sickness, systemic. Hello, students. And example of type 3 is serum sickness, systemic lupus erythematosus, post-streptococcal glomerulonephritis, and Arthur's reaction. We have done this example individually in the chapter. We would not spend too much time. It would become what is exam point you have to remember. See, type 3 hypersensitivity involves antibodies. So you can, what does antibody spelling is ANT, and what does 2T stand for? 2. So 2 make a mnemonic and remember against fixed antigen, whereas type 3 hypersensitivity is an immune complex mediated disease. Okay, this chapter is enough. See you in the next